Chapter 6, Nutrition Informatics and Documentation of the Nutrition Care Process. Learning objectives. Describe the different types of nutrition documentation, their purpose, and their appropriateness of use. Define the role of nutrition informatics in nutrition practice. Identify the major steps in the writing process and their importance. Explain the foundation for maintaining professional competence. Students often are surprised to learn how much writing and information retrieval they have to do in the workplace. A recent nutrition informatics survey revealed that the majority of registered dietitians report that the ability to access electronic data was essential to their work. Informatics is the study and practice of how best to collect data so that meaningful information and knowledge can result. In 2009, the Health Information Technology for Economics and Clinical Act was passed, mandating that covered entities receiving reimbursements from the Centers for Medicare and Medicaid Services move to using electronic health records. The Academy of Nutrition and Dietetics Health Informatics Infrastructure is a web-based system provided by the Academy for collecting health outcome data for dietitians in practice. It's free to all members of the Academy, so that's registered dietitian nutritionists and DTRs through the Commission on Dietetic Registration. It's designated to collect only de-identified nutrition diagnoses and follow-up data. Figure 6.1 is the Academy of Nutrition and Dietetics Health Informatics Infrastructure. The ANHII is an electronic system that allows documentation of de-identified nutrition diagnoses and data that can be used as a component of the National Quality Improvement. As part of the Health Information Technology for Economic and Clinical Act, institutions that receive reimbursements from the Centers of Medicare and Medicaid Services must send electronic clinical quality measures to CMS to report the quality of care provided. These measures are to be reported automatically using data from structured data fields so that there is no increased reporting burden on institutions and providers. An example of an electronic clinical quality measure currently in use is body mass index, BMI. Providers must report BMI for patients aged 18 years and older. Disadvantages of electronic reports include computers must be taught both terms and taught that they have the same meaning. Data may be lost, interoperability, or using standardized terminology can be difficult. Every medical institution or agency creates a medical record or chart for each individual patient served. A medical record is a systematic recording of a patient's care, a location in which all data related to the problem that brought the patient in for medical care are collected. In order for a healthcare provider to receive payment, the patient's medical record at discharge must contain documentations of the current procedural terminology, CPT codes, and indicate that the patient received the appropriate care. Clear, concise wording in the medical chart using terminology consistent with the prospective payment system will facilitate reimbursement for services. The electronic medical record, or EMR, is defined as a digital version of a paper chart that contains all the patient's medical history from one practice. The use of the EMR provides the ability to track data, identify health needs for a patient, with the ultimate goal to improve healthcare delivery for the patient. Purposes of medical record charting: legal documentation of medical care that the client has received, communication between members of the healthcare team, evaluation of medical care for that client, funding and resource management, continuous quality improvement, third-party reimbursement, accreditation, and research. The electronic medical record is defined as a digital version of a paper chart that contains all the patient's medical history from one practice. The use of the EMR provides the ability to track data, identify health needs for the patient, with the ultimate goal to improve healthcare delivery for the patient. Advantages for the use of the EMR and the electronic health record include expedited transcripts and delivery of physician orders, reduction of errors, improvement in patient safety, and facilitation of achieving positive patient outcomes. Disadvantages: inconsistency across systems, potential for clinical errors, and cyber security. Figure 6.2, an example of an electronic medical record. The EMR template used at Fairfield Medical Center in Lancaster, Ohio, incorporates the nutrition care process by promoting the user to enter nutrition problems, diagnoses, and interventions, as well as nutrition assessment data. Steps to ensure accuracy of the medical record includes the use of standard language and medical abbreviations. Each healthcare facility designates a list of acceptable abbreviations. The Joint Commission recommends that certain abbreviations not be used because they are more likely to contribute to patient care error. As healthcare in the United States continues to move towards digital EMRs and EHRs and personal health records, the RDN must be informed on the use of digital data, the protection of the patient's information, and the documentation of nutritional care that allows patient outcome measures. One common type of medical record is the problem-oriented medical record. The problem-oriented medical record is divided into 5 parts: data, problem list, care plan, progress note, and discharge summary. Table 6.2, the Joint Commission's official do not use list. This list applies to all orders and all medical documentation, written or typed. So some examples: do not use U for unit. Instead, write the word unit. IU, instead, write international unit. QD, like Q period, D period, you should write the word daily. Do not use lack of leading zero. Instead, you should write 0 point whatever the number milligrams, MS. Instead, you should write morphine sulfate. Do not draw out the greater than sign. It can be mistaken for a number, so write the word greater than. Instead of using the less than sign, write the words less than. Instead of doing the symbol for at, write the word at. Instead of using cc's, write milliliters. You can abbreviate it with capital M, L, or you can write the word milliliters. The label SOAP, SOAP, refers to the 4 sections of each entry in the medical chart: subjective data, objective data, assessment, and plan. SOAP is the oldest and most well-known form of medical documentation. Subjective data includes patient information or data collected from the patient or caregiver. Objective data include the empirical information, that is information drawn from physical tests and medical staff observations that are of consequence to the patient's nutritional status. Assessment is the nutrition diagnosis or interpretation of the patient's nutrition problem. The plan will include an outline of interventions necessary to treat each nutrition problem. The ethos for SOAP notes must be authoritative, knowledgeable, and professional. PES is the organizational structure or format in which the nutrition diagnosis is written: problem related to etiology as evidenced by signs or symptoms. The PES statement is simply the manner in which the nutrition diagnosis is documented. The ADIME, or ADIME, Organization for Nutrition Documentation, was designed to reflect the nutrition care process. Relevant data about the patient's condition or recorded in the assessment section. The diagnosis section is where the actual PES statement or statements are listed and prioritized. The intervention section provides documentation of the specific treatment goal and expected outcomes, interventions, and response of the client. Finally, monitoring and evaluation section records documentation of progress towards the goal set, factors that are facilitating or hampering progress, and any changes in the client's level of understanding or behavior and future plans for care. IER is a simplified version of SOAP. Intervention refers to what has been done for the patient and the patient's response to that treatment. Evaluation refers to the assessment or of the SOAP, the diagnosis, and evaluation based on the data collected. Revision of care refers to any changes recommended or ordered in the patient treatment. Focus notes are a blending and reduction of SOAP and IER format. Data simply collapses SOAP's subjective and objective data section. Action refers to the SOAP assessment and IER evaluation section. Response represents the SOAP plan and any changes relevant in treatment. Problem intervention evaluation notes are also a blending and other type of charting. Problem identifies the specific nutrition problem for the client. Intervention refers to the nutrition treatment and steps designed to resolve the problems. Evaluation outlines the progress towards resolution of the nutrition problem. Charting by exception is an even more abbreviated approach to medical charting that involves recording only unusual or out of the ordinary events. Novice health professionals may not have enough experience with patient care to know what might be important and what is probably not going to be important. Novice health professionals should consider keeping a personal medical notebook where they can brainstorm problems and perhaps most likely where they can include their subjective experiences and express their own emotional and intellectual responses to their experiences. It is imperative, though, that any PHI not be used outside of the clinical care of a patient. Doing so would be in violation of the Health Insurance Portability and Accountability Act laws, or HIPAA. Guidelines for all charting. Chart what you see as significant. Sign with full name and status. Be timely. Do your own charting and never chart for anyone else. Do not chart procedure until it is completed. Remember, charts are legal as well as medical documents. If charting by hand, use black ink. Write clearly so the meaning of your notes is clear. Avoid abbreviations unless you are certain they will be immediately understandable. If handwriting, begin your note immediately after the previous note. Do not leave white space. Include too much detail rather than too little. When writing objective notes, do not assume or infer. Set aside bias or biases. Use neutral language. Use patient or client rather than name. Always keep record intact. Cross out mistakes with single horizontal line or write the word error above it. Sign notes after printing name electronically or by hand. Include date and time. Follow agency or institution's guidelines. Health Insurance Portability and Accountability Act of 1996, Public Law 104-101. Goals of HIPAA are to create a uniform way for all providers and health plans to send and receive health information electronically, prevent inappropriate use, and disclose of any individual protected health information. HIPAA contains 3 parts relevant to healthcare information: privacy of individual identifiable health information, standardization of transcript and code sets, security of electronic health information. Writing to the community of health professionals within your institution or agency through chart notes will become easier with practice. Writing functions in both our personal and professional lives in a variety of different ways. To record information such as agreements among people, documentation of healthcare in a medical facility, or documentation for legal purposes. To inform either as a report of experience or research findings or a dissemination of information developed by other, to persuade, to entertain. Each form of writing within the workplace is produced with a context, and every context involves at least four elements: subject matter, what the text is about; purpose, a reason for writing the text; audience, a set of readers to whom the text is directed; ethos, the personality of voice that comes through in text and characterizes the reader for the. Let me say it again. Ethos, the personality or voice that comes through the text and characterizes the writer for the reader. Just as every text exists within a context of rhetorical norms, it also consists of an overall organization of words, sentences, punctuations, paragraphs, and larger passages, all of which communicate the writer's idea and the context of the writing. Steps in the writing process: pre-writing or intervention, whether it is that the writer does before actually writing; drafting or actual sentence generation. Successful writers tend to do some revising during drafting. Revision: in addition to revising while drafting, successful writers virtually always make revisions to their text after it has been completely drafted. Editing: after the text has been drafted and revised, successful writers also spend time making minor corrections at the sentence and sub-sentence level of discourse. Report your own research. Follow code of ethics. Your professional obligation is to convey accurate information for all audiences. Take continued professional education. Draw on ongoing knowledge.